Hi, so today we're going to be talking about schizoaffective disorder. Now, you may be wondering, what is that exactly? It's very similar to schizophrenia, except there will also be a presence of mood disorder symptoms, which we'll talk about later. The exact cause of this disorder is currently unknown, but some factors that may be involved in its development include genetics, brain chemistry and structure, stress, and drug use. So, here are the symptoms we mentioned. The first few are symptoms that are usually associated with schizophrenia, so delusions, hallucinations, disorganized speech or thinking, changes in behavior, and negative symptoms. But the last two are the mood disorder symptoms that are going to set apart schizoaffective disorder from schizophrenia. So, in addition to these first five symptoms that we've listed, there will also be a presence of depressed mood or manic behavior. And for further clarification of these symptoms, we've provided definitions and some examples on the slide. But if you or anyone you know is experiencing any of these symptoms, we highly recommend that you please consult your doctor. So, who's affected by this disorder? Well, it's relatively rare, only affecting about 0.3% of the population. We typically see these symptoms start to develop from late adolescence to early adulthood, but it can affect anyone. It does not discriminate. It can affect people equally, regardless of gender, race, culture, or geographic background. However, in men, it's often developed at an earlier age. Medication and therapy is usually used to manage schizoaffective disorder, and we've provided some examples of medications and therapies on this slide, but your doctor can help you figure out what medication and therapy is best for you. Should you or anyone you know be experiencing any of these symptoms and you feel concerned, here are some support and community resources for you. So there is NAMI, the National Alliance on Mental Illness. They have a lot of great resources online. But if you are more local to the Santa Clara County or San Jose area, we have some local resources listed here. So there are some resources provided at Evergreen Valley College, San Jose Behavioral Health, and Recovery Cafe, and we've provided all their contact information on this slide, but we will also link these resources down in the description. But for suicide and crisis prevention, please call 988. And for any life-threatening emergencies, please call 911. Here are our references, and thank you so much for watching.